Howdy, and welcome to so much more than telemedicine. We are Sniffle, and we are thrilled to have several of you joining us today. So we made our debut last week at Thrive in Austin, Texas. We had a phenomenal debut. We met lots of great people, lots of great clinics, lots of administrators trying to do big things and to use technology, advanced technology, and AI to do more. We are the first AI-driven virtual care ecosystem that focuses on providing solutions for both clinicians and patients. Better care, bigger picture. To us, that means we're going to use AI, we're going to use advanced technologies to help people live healthier lives and lower healthcare costs. At Thrive last week, a hot topic of discussion was AI in healthcare. And there are lots of ideas, lots of potential about what AI could be used to do. Here's the great news. Sniffle has already purposed medically curated AI to serve clinicians, to serve patients, to serve hospitals and clinics. We're using AI and advanced tech to simplify and expedite intake. We're using AI and advanced tech to help validate treatment plans, billing codes, identify better pricing on prescriptions. And with all of this, we've been able to do this while becoming an extension of the existing workflows of these practices and clinics and hospitals. That means when you sign off on the authorization access form with Athena, in this example, Athena flips a switch and you're instantly integrated. There's no implementation team that has to come on site or a multiple week timeline needed. You're ready to start making the most out of your Athena platform to help treat patients more efficiently and more effortlessly. We, all of us here at Sniffle, we believe in health equity and access and advocacy. We created tools to bring these things to patients across the nation, while also enabling the support and growth for clinics and providers. We're going to actually show you what that looks like. And to do that, I'm going to introduce Todd Costello, our VP of Product, to show you how we're doing these things through the Sniffle for Providers app and web-based platform. Todd, over to you.
Yeah, thanks, Chris. So I'm a VP of Product Management, and we'll kind of take you through what the Sniffle app does and why it'll bring value to your organization. So first of all, you can sign up in 15 minutes. So you just create an account. We verify the identification of the person on the provider app, and within 15 minutes, you can actually see our interface and start to go through steps to complete an implementation. The implementation, the whole onboarding is less than 24 hours. That's a full EHR integration, no tech support needed. You can start writing prescriptions at that time. So we enable providers to quickly onboard. Again, no cost to the clinic. We are really working towards making healthcare more accessible. Again, all for $0. So you can add other providers. We provide marketing support included. We'll send you a welcome kit to let your patients know with QR codes and a whole care package to start growing your business without you investing money. This includes digital marketing along with items that will be sent to your office. So what do we do specifically? We have that AI-driven patient symptom assessment. As you can see here, this is showing a patient with arthritis. He runs through an assessment. How do they do that in the app? The first screen here is the Welcome to Sniffle screen. So again, this is free to download, no sign up required. You can use the assessment tool for free. So you basically download, start sniffling, add a little bit of patient information, add your symptoms. That'll take you to a questionnaire of related symptoms and ask you very specific, again, AI-driven questions to come up with a diagnosis result. This example that I put in here had to do with back pain, and the end result is you should see a provider. So we let you schedule that appointment as a patient straight from the application after the diagnosis. So we wanted to make that this platform easy to use with automated patient intake. So that assessment that you just completed would be sent directly to the doctor and would be under the complaint, and then also the history. So after you've done the diagnosis, you've decided to schedule a virtual visit, we will then verify your medical history, your current health and lifestyle, your family medical history, again, to basically reduce the burden on administration and allow providers to focus on what they do best, and that's taking care of patients. Once you've scheduled the appointment, the patient sees the appointment on their welcome screen. When the appointment's ready to start, we will remind them with a text message, and then this screen will change to join the appointment. We also have AI-driven research tools for the provider. So once a patient has completed their scheduling, which includes that diagnosis and that intake, the doctor is then able to view all of their symptoms and then research prior to the visit. So in this case, I'm looking for treatment for lumbar strain with radiculopathy, and what it gives you is a fully curated plan for that condition. We also give the ability to write prescriptions directly from the platform. So when a doctor, again, has a visit scheduled, you will see on their dashboard, so this is the provider view at this point, they can see all the scheduled visits. Again, when the visit is about to start, that'll change to ready to start. They can do this not only from the web, but anywhere from their phone. So that's Android or iOS. They will be able to complete a visit remotely or in the office. The prescription screen allows them to add prescriptions. Again, this is from the web or Android or iOS, and complete a visit with within 10 minutes typically. The application is made to be easy to use and very fast for those providers. Once the visit is complete, we do a full set of SOAP notes. So we have an after visit summary that the doctor has access to and the patient has access to. So from the phone or from the web, they can actually download a PDF with the full appointment details, including the patient information, the payment, the insurance, the diagnosis plan, whether labs or imaging were ordered, the prescription, the pharmacy that prescription was sent to, and then any of the coding. We also include the full result of that diagnosis intake and the history, and then the HIPAA release and the informed consent. So this information that we gathered doesn't just stay in our app. We are integrated fully as an extension of Athena-1. We have over 47 endpoints. We create and update patient info. So we know when a provider sees a new patient that it is a new patient, and we create that new patient. If it's an existing patient, the record is stayed intact and not duplicated. And this new appointment would be attached to that patient for continuity of care. We verify available slots based on doctor settings. We do the check-in, the checkout. We book and cancel appointments. We update the charts. So as I was saying, as I showed that after visit summary, all that information is automatically through our API calls updated in Athena-1. We add the billing info, the ICD-10s, the CPT, and any of the modifiers. We update the patient's pharmacy. We upload triage, before the appointment, as we've talked about, the SOAP notes. So this really creates a full process where the doctor can focus on care versus having to deal with any of the intake or administrative items for a virtual appointment. People typically ask, okay, this is too good to be true. How are you making money if it's free for the providers? Well, we really want to help not only the providers reduce their cost, but patients reduce cost of services. So we supply a free RX discount card. You can search any prescription that your doctor has prescribed, find the pharmacy near you with the lowest price. Typically, it'll save you between 10 and up to 85%. We had a situation where someone would have a monthly prescription that they would fill, and it would cost north of $40. With our discount card, it was less than $8 a month. So, and that is absolutely free. If you want to add on vision, dental counseling, the diabetic supplies, the hearing aids, lab testing, or imaging, that is only $15 a month. And one of the testimonies that we've heard is from a person that had contacts. A 3-month supply of contacts was around $400. And this is what they were paying quarterly. They used our vision provider and were able to get those contacts for $80 for that same 3-month supply. So what this allows us to do is save patients money, reduce burden on providers, and really create an ecosystem where everybody's benefiting. And because we do get the $15 a month, this is how we support our ecosystem. Any questions or comments? Chris, I'll turn it back over to you.
Thanks, Todd. So you can see how we're incorporating AI and advanced tech to help your practices and clinics. Now we want your input and guidance. And I want to really emphasize this revenue model of $15. This is how the organization continues to invest in this technology. But why do we do this? We do this to strengthen and reinforce the relationship between your clinic and your hospital and your patients. There are some really damaging business models that exist in telehealth when it comes to patients seeing random doctors and random patients getting care from random providers. That doesn't support healthcare long-term. Teladoc, GoodRx, virtual visits, Costco, Walmart, these retailers are not where providers should be delivering care. It may seem convenient, but it will damage both providers and patients' access long-term. So our combating of that is to create this movement and to align ourselves with clinics and hospitals and say, let's reinforce, let's make sure that these patients stay with you, your medical team. How do you do that? You download Sniffle for providers. You complete the onboarding process in less than 15 minutes. You're up and running, delivering prescriptions in less than 24 hours. And you do that for a total investment of $0. This platform, we invested over $3 million in building out this ecosystem, but we give it to you for a total investment of $0. Why? Because we want to recapture healthcare. It's not to go down this path of these bad business models. It's to keep the real stakeholders, providers, physicians, clinics, clinicians, and patients, focusing on serving them. If you'll allow us to come alongside you and learn from you, then we can shape this tool to serve you and your clinics and your patients and your communities even more. Give us your feedback. Tell us what workflows could create greater efficiencies. Guide us to what would make your patient panels happier. We've built this over the last 3 years, but now we need your help to ensure it's as highly curated for the needs of your patient panels and your community as possible. We are an extension of Athena One, which means we're looking to be an extension of your practice and the incredible impact you make for your patients in the community. We're grateful for that small role that we play, but we know that it's an important role. and we're here to be of great service to you. Onboard your clinics and let us know the progress you're making. We are here to be of service. You can connect with us through our different social channels or through our website, or contact Athena, and they know how to get in touch with us too. We're grateful for your time and hope that we get a chance to be of service soon.